Right, in today's video we're going to be going over the patch test procedure with the 1200 plus, and this patch test procedure is going to be done on the underside of the forearm because we will be then using those settings on the face. Now the reason why we do it on the underside of the forearm opposed to patch testing on the face is that if there is something that I've left off in the consultation form, or there's something that could pop up as a contraindication that you're not aware of, you'll see it on the forearm patch test before you obviously go through and treat on the face. Other thing to keep in mind as well is on all of our Eclipse machines we have recommended treatment parameters, and so they generally start quite low, they're quite conservative. So even if you were to see something that pops up as a contraindication on a treatment, it's not necessarily going to result in a burn, but you will see a kind of bit of erythema in the skin. So the test patch procedure is quite important to do no matter what the treatment is. Now this test patch procedure is what we call standard IPL, and that would generally be used for skin rejuve, pigmentation, vascular and acne. So you'd go through this as part of your consultation, and then you would take those settings into the treatment area when you perform your first treatment. So what we do recommend is doing a patch test 24 hours, at least 24 hours before you do the full treatment. And we understand that that's not always the case, but you really need to know what you're looking for in the skin if you're not going to follow those guidelines in that 24-hour patch test. But that's what we do recommend. Now the other questions we ask before we go through and do our test patch, there's 4 main questions. So any sun exposure in the treatment area in the past 2 weeks, sunburn for example, any light sensitive medication or any medication in the past 30 days, have you been to the doctor for anything else in the past 30 days, which is generally something that teases out some medication if they are on it, and then any acne medication in the past 6 months. Those are the main ones that we want to cover, and obviously they've already gone through and filled out their full consultation sheet that you've gone through before you do your treatment. Now those 4 main questions we ask whenever they come back in, whether they've had a treatment before or not, always asking those 4 main questions. So now what we're going to do is we're going to take the skin type reader, we're going to place that on the skin in the treatment area. So we're just going to do 4 spots. So those are all coming up skin type 2, so skin type 2 on here. And then what we're going to do is punch that into the machine, set up the parameters in the machine, which I'll show you in a sec, and then we're going to do our patch test on the underside of the forearm. We'll start off on our base level, and then we'll slowly bring the energy up. And then once we've done that patch test procedure, the client will go away, and then when they come back the following day or in a couple of days, then we'll take that setting and then we'll move in and do the treatment on the face. So now we're going to set the machine up for that treatment. So pressing enter, male or female, and then we're coming through skin type 2, so select there. We're going to be doing a skin rejuvenation treatment on this client, so SR for skin rejuve, enter. Now most of the time you'll come into intense. The only time you would come into medium would be if the skin was quite aged or frail. So we're doing a pigmentation treatment on the hands for example on an aged client. Coming into intense. Now smart mode here. So all these pulse widths and delays are all preset. You can't change any of those, so they're all preset for this specific skin type and for this treatment. Now what we've got here is we've got our energy setting here, so starting off on 26. Now the recommendation window is here, so 26 to 32 is our kind of baseline settings that would start off on, and then also the 510 filter. So we're grabbing our filters out of the box here. Now there's only one that says 510. So grabbing the 510 filter, and then we're placing that into the handpiece, clicking it in, and then removing the crystal cap off there, placing that back into the holder. So what we're going to do is we're going to start off on 26. That's going to be the very lowest setting, and remember what I said before is that these settings are quite conservative in terms of the recommended window here. So we'll start off on 26, do our first patch test, which will be 1 flash, and then we're going to come up 3 levels, 1, 2, 3, into our next patch test, and then we're going to do 1 more patch test there, and then we're going to come up 3 more levels. So we'll just bring that back down to where we started, 26, and then we'll do our first patch test. Right, so now we're just going to apply a small amount of gel. So we want enough gel so we can safely put the crystal on the skin without treating over any dry skin. So just placing it on there, and then that's where we'd flash it. We can just choose any spot we like, and then with the following patch test, we'll just be shifting as we move through. Okay, so once the gel is all applied to the patch test area, we're just going to pick the handpiece up, hold it in our hand, have our glasses on, and then we're going to press standby. Come into standby, that's then going to illuminate the bulb and start cooling the crystal. And then it's not until everyone's got their glasses on, the door's locked, everything's all safe, that we will then press ready. Now the handpiece won't flash when it is in standby mode, it will flash when it's in ready. So ready is like your on-off safety switch. So then once everyone's ready, pressing ready, and then we're going to do our first patch test at 26 and then increase from there. Alright, so first patch test here, so just getting the crystal nice and flat on the skin and just counting down, 3, 2, 1. So just one flash and sitting that down. And then what you can do is you can come off ready, and now the first question I asked the client is, how did that feel? Was there any sensitivity there, any heat at all? Generally, if they say, oh, there was a lot of heat there and it was really uncomfortable, that would be an indication there's something not quite right there, and you'll delve a little bit deeper in terms of their medication or anything that could be on the skin or anything like that. Generally, what you'll find is they won't feel any kind of heat, maybe a slight little bit of heat, but not a lot. So that's quite conservative on this lower setting. Now you can take it one step further as well and come off ready. You can bring your glasses up and just take a quick look at the skin, just making sure there's no erythema there and it's not red at all, and all looks fine. And then so once we've done that first patch test there, we're just going to increase by 3 levels, 1, 2, 3, so we're at 29 now. And then just coming back into ready, and then coming just next door to where that last one was, so I can see here where I placed the crystal on the last one, so just coming next door to that, 3, 2, 1. Then once again, just asking that same question, how did the client feel with that last delivery of energy? And then also just taking a look at the skin and making sure it all looks fine. So then what we're going to do is we need to come off ready to change the settings. So off ready, we're going to come up, 1, 2, 3. So we're at our higher end of the recommended energy level here, and this is quite common. So it's quite common to be up around the higher end of this scale. Now we keep these settings quite conservative for the reason that most clients will be able to handle a higher level of energy, but some won't. So we want to start off low, slowly bring the energy up in increments, and then get it to a nice level where we then take that setting onto the treatment area and then do our treatment from there. So we don't want to, for example, I know that a lot of skin type 2s can handle, energy level of about 36 or 37, but if I go down the road of treating everyone under that same energy setting, I may have 1 out of 10 or 1 out of 20 that has an adverse reaction. So same protocol with every single client, just coming through as part of the patch test, coming up slowly in those 3 energy level increments, and then we'd come through and do this last patch test now. And then if we get up to this energy level of 32, then we'll take that onto the skin. Now if the client felt really uncomfortable at energy level 29, for example, if it was a 8 out of 10 in terms of rubber band flick and intensity, then we'd generally leave it in there. If you're around this 32 and above, you're going to get a really good result. So with your patch test procedure, bringing it up to this 32 in those increments, and then going through and doing your treatment from there. So we'll do this last patch test now, and then that would be the test patch procedure complete for a standard IPL treatment. Right, so just coming back on ready, just coming next door. So our first one was here, second one was here, so we're just coming just slightly up here, and then 3, 2, 1. And then once we've completed that last patch test, we can come off ready and come off standby. So now what we'll do is we'll remove the gel off the client. The client will go away for 24 hours. And then when they come back in, we'll use that energy level 32 for the full treatment on the face, for example. And this is the same procedure for any of your standard IPL treatments. So that be vascular, pigmentation, skin rejuve, and acne treatments.